Hello friends, if you have pain on the bottom of your foot, there's a very high chance that you might be suffering from plantar fasciitis. Plantar fasciitis is inflammation of the fascia, which is a band of connective tissues at the bottom of your foot that runs from heel to toes. Some research shows that plantar fasciitis may not be an accurate description of this problem because samples taken from patients undergoing plantar fascia release surgery shows that degeneration rather than inflammation. So some scientists refer to this particular medical condition as plantar fasciopathy instead of plantar fasciitis. Now, what are the risk factors that put you at increased risk of plantar fasciitis? Overweight people are at increased risk of plantar fasciitis because of extra pressure on your fascia. High heels are usually a fashion statement, but they also lead to extra stress on the fascia. Wearing ill-fitting shoes or those with thin, worn-out soles can make you more susceptible to plantar fasciitis, and very rarely some people have abnormal pattern of walking or foot position. This can affect the way your weight is distributed when you are standing and put added stress on the plantar fascia. People who spend long time on their feet, like nurses, pharmacists, or people who run or jog quite a bit, are more likely to develop plantar fasciitis because plantar fascia stretches and contracts and the repetitive strain can cause an overuse injury. That's why sometimes plantar fasciitis is also called jogger's disease. And sometimes simply age can be a factor. It has been found that people between the age of 40 and 60 are at high risk of suffering from plantar fasciitis. Now, how do you confirm diagnosis of plantar fasciitis? If you have sharp stabbing pain on the bottom of your foot around your heel and arch, then it could be plantar fasciitis. This pain is usually felt after a period of inactivity, and as the activity progresses, pain will improve or resolve. For example, when you wake up in the morning, take first few steps, you will feel the pain. Or if you sat down for a little while, then you get up and take few steps, you will feel the pain. But as the activity progresses, pain will go away. And one more thing, if you are trying to do exercise, pain will be felt after the exercise, not during it. All these symptoms are enough to confirm the diagnosis of plantar fasciitis. Sometimes your doctor may order ultrasonography or MRI just to confirm the diagnosis of plantar fasciitis because in some cases, in some rare case scenarios, plantar fasciitis could be confused with ankylosing spondylitis, osteoarthritis, or pinched or compressed nerves. If ultrasound shows thickening of fascia more than 4 mm, then diagnosis of plantar fasciitis is confirmed. Also, formation of osteophytes, also called heel spurs, and occasional calcification around the soft tissue of heel may also show in the ultrasound. Similarly, MRI will show increased thickening of the plantar fascia and increase in the signal intensity of the plantar fasciitis. This is all for today. In the next video, we will talk about how can you treat plantar fasciitis at home.